Hi, this is Professor Teresa Salinda. Today, I will be going to discuss about the principles of health education. Health education is the process that concern with designing, implementation, evaluation, and educational programs. It also a combinations of learning and experience which help us to promote individuals and communities to improve quality care by increasing their knowledge that influence their attitude. We have principles of health education will serve as a foundation. The first one, health education pertains to the health status of the people, wherein this is the main one of the main goal to assess the health status of each individuals, families, and communities that will help them to promote or achieve health care quality. The second one, health education is a learning. So, in order for us to that we have that learning is we gather information. By that, it is a continuous process wherein we continue to learn and those learning will probably use in order for us to create a goals or a plan for the health for a healthcare plan or a community for a certain community. Third one, health educations involve motivations, experience, and change. It also, the basic function or the main core also are the health worker, wherein they will serve as an agent in order to deliver the health teaching. And it should take place, it is start at home, the schools, and community because learning, we start at home, then in the schools, and in our community. Next, it is also a cooperative effort. So we need also to cooperate with each other in order for us to attain the optimum level of wellness. It also shows a continuous process wherein it is a systematic process that we need to follow or we need to notice what are the best care for each individual. And of course, the needs, the interests, and problems that we must address. So it is necessary for us to know how to listen and be sensitive enough to the needs of other people. And by that, we will be able to, health education is also achieved by doing. So we should have take an actions in order for us to promote that health care. And of course, it also is supplementary age and device and a community resources, creative process, and effort that we should deliver to each individual. Planning, organizing, and implementing, and of course, integral part. And we have the responsibility in educating people, wherein this is one of the main functions of health education. And of course, to impart information that regards to healthcare. What is an health educator? An health educator is a facilitator or an implementer of the process. So we initiate we initiate on how we're going the people will learn to improve their health attitude and habits to work together of the improvement of health conditions of family, community, and nation. But what are the qualities? The qualities must be efficient. We should know how to listen, a good listener. It should be systematic. We should be analyze the situation well. We should be tactful and be sensitive enough on what is happened that surround us. We should also be knowledgeable. It is also that we are competent enough, a good communicator, a keen observer, a creative one with sense of humor, a change of agent, and of course, we facilitate openness when it comes to an active participations or in this during discussion perhaps. The second one is the concept of teaching, the learning education process, wherein in here, what is the difference between teaching and learning? First, we have on the teaching, this is the process of imparting to the learners the knowledge and skills that require a master prescribed subject. It needs also a competency when you're going to teach, and your dedications when you have dedication in your work. In learning, it is also a mental activity by means which knowledge, skills, attitude, and appreciations and ideals that are required, resulting in the modifications of behavior. The modifications come through knowledge and experience. Now, we're going to discuss the education process. If we say education process, it consists of two major interdependent operations, wherein the teaching and the learning. But aside from that, it also involves planning and implementations on a teaching based on the assessment and prioritizations of a client's, for example, the learning needs, the readiness to learn, and the learning style. Here are the example how the educational process parallel to nursing process. So first one, we have what we call the assessment, wherein in the nursing process, we appraise physical and psychological needs. In the education process, we ascertain if there is a learning needs, if there is a readiness to learn, and the learning styles which is applicable to each learner. For the planning, we develop care plan based on the mutual goal setting to meet an individual needs. In the education process, we develop teaching plan based on mutually predetermined behavioral outcomes to meet an individual needs. On the implementation phase, for nursing process, we carry out nursing care with the intervention using standard procedure, while in educational process, it's perform the act of teaching using the specific instructional methods and tools. And on the evaluation part, we're going to determine the physical and psychological outcome, and while in the educational process, we determine the behavior changes, the knowledge, and the attitude and the skills. What is an education? To further analyze the education process using second one is the Assure model, wherein first you're going to analyze the learner. The second, we're going to state what will be our objective that we need to implement or we need to do. Third is we're going to select the instructional methods and materials that right for the learners. Fourth is we're going to use instructional methods and materials, and it requires learner performance, and we evaluate the teaching plans and revise. The third one is the historical foundations for the teachings of role of nurses, wherein patient education has been considered a major component of standard care given by nurses. In 1950s, the development of NLE, wherein it is identified content in nursing schools curricula to prepare the nurses to assume the role as teachers of other. The second one during happened on that happened rather in 1950s is the CNE, or what we call develop the first certified nurse educator. It is also, this is through an examination. Third one is the American Nurses Association, wherein it is a set forth of a statement on the functions of the standard and qualification of nursing practice, of which patient teaching is a key element. Fourth one is the International Council of Nurses, and as of today, we have what we call the NPA, wherein the Nurse Practice Acts with a scope of nursing practice responsibilities. So these are the nurses' legal mandate that are expected to provide instruction to consumer to assist them to maintain optimal level of wellness. During 1970, this is the American as Hospital Association. It is also developed by the Patient Bill of Rights, has been adopted by the hospital nationwide. So, this Patient Bill of Rights is established as a guideline to ensure the patient receive complete and current information concerning their diagnosis, treatment, and prognosis in terms that they can reasonably expected to understand. In the mid-1800s, teaching has been recognized. So, in here, the responsibility for teaching has been recognized as the important role of nurses as caregiver. The focus here is to care of the sick and promotions of health of well public and educate the other nurses for professional practice. A very famous here is Florence Nightingale, wherein she is the founder of modern nursing and ultimate educator and developed the first school of nursing. So she devoted a large portion of her life to teaching nurses, physicians, and health officials about the importance of proper conditions in the hospital homes to improve health of the people. By early 1900, it is the public health nurse in the Philippines clearly understood the significant role of the nurse as a teacher. So the public health nurse in the Philippines clearly understood the role as a nurse and teacher in preventing the disease and maintaining the health of the society. And the patient teaching has been independent nursing function. In 1918, the National League of Nursing Education has now changed to National League for Nursing, or NLN. So, the 2 decades later, the organization recognized that nurses as an agent for the promotions of health and preventions of illness in setting in which they are. In 1993, this is what we call the Joint Commissions on Accreditations of Healthcare, wherein it recognized the importance of patient education by nurses, establish the nursing standard, and those standards mandate describe the type and level of care, treatment, and services must be provided by the agency or organization to receive accreditation. It also expands on the literacy level, educational background, language skills, and culture of. In 1995, it is also the recommendations of Health Professional Commission, wherein it should be clinically competent and coordinated care to the public, patient and their families in decision making, education and counseling, public access, cost-effective appropriate care and preventions of illness and promotion of healthy. There is a transition that happens. So that is on during uh 1995, the transition toward wellness has entailed at progression from disease-oriented patient to the preventions of oriented patient to health-oriented patient education. So these are the approach wherein from one wise healer to expert advisor to a facilitator of change. So it also emphasizes here on the empowering the patient to the use with potential abilities and resources to the fullest, and training to the trainer and serving with the clinical instrument. In 2006, there is a Institute of Healthcare Management were organized that is to reduce 15 million incidents of medical harm in the United States hospital each year. In 2007, the Sullivan Alliance were in to recruit and educate the staff nurse and effective healthcare and health education, wherein the goal here is to increase the racial and cultural mix of nursing faculty, student, and staff, because sometimes differences will serve as a gap. So, in the Sullivan Alliances, their aim is to increase the racial and cultural mix of each faculty, students, and that's end my presentation for listening.